So the problem that we work on is trying to address a massive unmet medical need in a rare pediatric disease, a neuromuscular disease called Duchenne Muscular Dystrophy. So this is a really horrible disease that affects boys predominantly, so about 1 in 3,500, 1 in 5,000 boys. So although it's rare, it's actually one of the most common genetic diseases diagnosed in children. And so the issue with this disease is that these children have these mutations in a gene which means they can't make a structural protein in muscle called dystrophin. So when they are missing this protein in their muscle, it means that when they exercise, when they use their muscles, it's not protected against the damage that can result from that. So they get massive amounts of muscle degeneration and it's progressive, a lifelong condition. So children go into a wheelchair when they're 12, 13 years old, typically with this condition. Most therapies that are trying to tackle this disease are trying to restore that missing dystrophin. But the problem with that is there are hundreds of different mutations, and that makes a huge challenge with therapies that are trying to tackle these individual mutations or groups of mutations. And so you're taking something that's a rare disease, and the patient population is even more fragmented. So it's a huge challenge in trying to treat this condition. We saw the first gene therapy being approved, which is really exciting in this condition last year. But the problem with that is there's still 30-35% of patients who can't take the gene therapy because it raises an immune response. So there's a desperate need for something else, and ideally, our view was something that would work irrespective of the underlying mutation. What we do is we have been working to develop a small molecule therapy that could increase levels of a protein that can compensate for the missing dystrophin. And that protein is called utrophin, and it was discovered about 40 years ago as being an equivalent of dystrophin, which is present in developing muscle and repairing muscle. We were fortunate enough to receive support from Harrington in the form of that scholarship in 2021. That has been pivotal to us to be able to progress these next generation utrophin modulators. The current options for these patients are relatively limited. So even with the therapies that have gone into the clinic and have been approved over the last few years, they are limited in terms of their efficacy. They're limited in terms of the patients that are actually able to access them. What we hope that a utrophin modulator will do as we progress that to the clinic is it will become accessible to all patients, irrespective of their underlying genetic diagnosis. And that could make all the difference. The other thing that's important about it is that utrophin modulation, we know, can be added on top of those therapies which are aiming at improving dystrophin. So it's been shown that those two can act together. So actually, rather than being a competitor to gene therapy or a competitor to some of these antisense oligonucleotide therapies, this will be an add-on to those as well. And I think will, in combination, make a big difference to patients' lives. The Harrington Discovery Institute has been invaluable in all the work that we've been doing to try and progress these next generation utrophin modulators towards the clinic. And it's not just been about financial support, which of course has been incredibly helpful to fuel the work that we've been doing and coming in at just the right time to give us that extra chemistry, that extra formulation work that we need in order to progress and overcome these problems. What's been so important from the Harrington Discovery Institute has been the interaction with the advisors. That access to those experts and having them scrutinize your project day in and day out, having them there to consult when you come up against a problem, because any drug discovery project is going to come up against problems, has just been transformative to us in the progress that we've been able to make, the rate at which we've been able to develop our project.